Hi, this is Dr. Malara. I just wanted to take an opportunity to address some topics that patients often have questions about. And one of the most often asked questions is, why do you need my medical history when I come in for an eye exam? And I can answer that simply by saying that obviously your eyes are connected to the rest of your body. And so it becomes very important, especially if you have health conditions like diabetes, hypertension, cholesterol, things that require medicine like that mean that there's going to be an impact in the rest of the body. For today, I want to talk a little bit more about diabetes. November is Diabetes Awareness Month. Although we take care of diabetics and do diabetic eye exams all year long, and we want to make sure that diabetics know that they need their eyes checked every year, especially if they are not well controlled. We work with your primary care physician, your endocrinologist, to make sure that we check your eyes regularly and then send a report to make sure that they know how well you're doing. When conditions are not so good, we have specialists that can help treat the diabetic eye disease and make that better. So for today, diabetes is an important thing to be aware of because first of all, if you're not aware of it, can cause a shift in your prescription. Your glasses prescription can actually change dramatically when your blood sugar levels go up. So why is it? Why does that happen? So blood sugar in the body the blood transmits oxygen to the rest of the body. And so blood, when it carries sugar, also needs to carry oxygen. So what happens? It needs to get that oxygen from somewhere. It grabs it from the water. So water increases the volume of what gets carried in the blood vessel. And so now we've got a bunch more fluid traveling in that blood vessel, and the blood vessels, as they get smaller and smaller, can't handle that extra volume, and so they begin to leak and bleed. And so that transmits to the fingertips, the toes, and the eyes. For the fingertips and toes, it becomes neuropathy, where things begin to tingle, become numb. In the eyes, it affects the vision, especially if it affects the central part of the vision in the macula. It becomes important for us to, when we see shifts in the prescription, to ask those questions, but also at the same time to take a good look inside the eyes. It's required, really highly recommended, that the eyes be dilated every year at the request of the American Diabetes Association as well as your medical doctor and the American Optometric Association. And so you may not see a difference in your vision, but we can fix that as well as monitor to determine whether or not you're at risk for diabetic eye disease. If you take a look on the screen over here, I just wanted to point out that this is an eye of someone who has diabetic eye disease, and you'll notice a few key things, one of which is the center of the vision in the macula. There's a little bit going on here, but most of what you see is peripheral. So this patient could very well still have 20/20 vision and yet have leaky spots all around where the blood is beginning to leak from the blood vessels, and that causes damage that you don't even know about. So we look in this eye, and even though you don't sense anything, we see it all happening right in front of us. And this tells us that we definitely need to get things under control, get the blood sugars back down, the A1C is under 7, and work with your doctor to get that to happen. If it begins to bleed more profusely, or the central part of the retina, the macula, becomes edematous or full of fluid, then that requires a referral to a specialist in the retina that can then treat that with either injectable medicine or with laser or some form of treatment to reduce the fluid, get it out of there so that it can protect the health of your eyes going forward. So diabetes is a very important thing to be aware of, and we take it very seriously, and we want to make sure that your doctor knows how well you're doing. So these reports that your doctor's requesting and that we're providing are an important part of our communication with them, and also in letting you know how well you're doing. So we recommend and highly hope that you will see us every year and that you will take your diabetes serious if that is your condition. So thank you for taking time to learn more about diabetes in the eye, and also giving us a chance to reach out to you and let you know that we are here for you, whether you need us for your eye care in general or just your doctor is needing you to have your eyes examined because he's concerned. At Molar Eye Care, we care about you, and professional eye care with a personal touch is what we do.